So today I will be dealing with you with the most important questions which have been asked in the FMG examinations and highly expected questions in the future FMG 2026 examinations. So let's go about the FMG Blitz, which is the latest for the FMG preparation, and then we start it over here. Thanks a lot. Now we start. So basically, what is there to study in the first subject, anatomy? Many of the students are terrified by the anatomy and what has been asked in the last 5 years in FMG about anatomy. Now, as far as this question is concerned, or the questions asked from anatomy are concerned, I have tabulated it in a very precise manner. Say, the topic number one, the joints in anatomy. And how many questions have been asked in the joints in anatomy? The dates are there. So as you can see over here, this is again a highlighted topic for FMG 2026. Now going through the classification of joints. So you know that there are many types of joints. There are the primary cartilaginous joints, the secondary cartilaginous joints, syndesmosis, hinge joints. And you can see over here, the question which was asked in FMG 2021 was what type of a joint is inferior tibiofibular joint. So as I have shown it over here, it comes under the classification of syndesmosis types of joints. Then again, what was asked in FMG 2022 is what type of joint is the temporomandibular or the TM joint, and it is a condyloid variety of a joint. So this is the way how we have been uh, tabulating the joints, how the questions have been asked, what are the future trends. So this is about all the things which we have compiled over here. Now that was about the joints. Now we go to the muscles of the front of the upper arm. And was there any question which was asked in FMG? Yes, it was asked about the biceps brachii, and the year was FMG 2023. So about biceps brachii, main tendon in posterior part of radial tuberosity, it was asked, and it was asked about the action of the biceps brachii as well, which is a supinator and a flexor of elbow. So this is how. Now again, the muscles of the back of the upper arm. A question was asked again in FMG 2023 about the function of triceps. So triceps brachii, what is the function? A powerful extensor of elbow. That is what I have tabulated over here. Then are there any other important questions which have been asked? Yes, in a sequential manner, what is Saturday night palsy? And Saturday night palsy is due to which damage? And as you are well aware, the radial nerve damage causes Saturday night palsy. And it is all given over here. My point over here is to make you understand what has been asked, the dates of the examination, what were the questions asked. Now, Walkman's ischemic contracture has not been asked, and I have put it in the category of high yield FMG 2026 because it has not been asked till now, and it is expected that it will be asked in future ahead as well. Now, radial nerve, coming to the nerves of the upper limb. FMG 2023, it supplies which muscle? Triceps. It was asked the injury to radial nerve causes what? It was again asked FMG 2023. You know the wrist drop, and at what level of the injury to the humerus it causes damage? It is the mid shaft humerus injury. So it is important in the radial groove. So FMG 2023, you can see two questions from the radial nerve. They were asked mid shaft fracture humerus and wrist drop, and as well as which nerve, which muscle it supplies. It is the triceps. So going down, this is a brief gist of what I have prepared this book like for you people to make it easy for you to get the highest merit. Again, the musculocutaneous nerve. In musculocutaneous nerve, which muscles are supplied by the musculocutaneous nerve? Biceps and brachialis. This was a question asked in FMG 2022. So that is very important. So going down, and then this is to just to show you how beautifully we have just tabulated these questions, and along with the questions, what year these questions were asked, and the specific line which was asked in FMG examinations from the examiners to you. Carpal tunnel syndrome. There was this clinical scenario given: a female presents with pain, tingling, and numbness of the affected hand, and there is the compression of a nerve at the level of the wrist, and which nerve it is? So it was median nerve compression as a result of carpal tunnel syndrome. And then in FMG 2023 and FMG 2021 and again in FMG 2021, it was asked loss of abduction of fingers and loss of abduction of thumb is as a result of which nerve? Ulnar nerve. So this is the flow. This is how I have tabulated these points for the sake of the FMG students. Now, anatomical snuff box, it was given along with the boundaries FMG 2024, a figure, and it was also asked in FMG 2020 and FMG 2022. Tenderness in anatomical snuff box signifies what? And you are well aware of there is an important bone, the scaphoid, and the fracture of the scaphoid usually comes along with a sign with the tenderness in the anatomical snuff box. So other than that, you can see over here, there are the points which have been mentioned, which are very, very important. These are the points which a student, FMG student cannot miss. And these are the crux, the high yield, and the most important questions which have been asked, repeated, liable to be asked and repeated again. So that is why it is FMGE Blitz analysis of the last 5 years of FMG papers. Going to the lower limb over here, femoral triangle is a very important entity, important region, and femoral triangle has been put under the category of high yield FMG 2026. So you can expect questions from femoral triangle as you have been asked about the cubital fossa, the boundaries, the floor, and all the things, the contents. As you can see, even the contents of the femoral triangle have been asked in FMG 2022. As you can see over here, I have labeled the dates. That is very important for you to understand that what question has been asked in which year. And it was a very pretty difficult task. And for the last 6 months, we have just been putting in the dates of the examinations. So that is how we have been able to compile this project for FMGE so that the students are benefited to a maximum extent. Then what are the other important topics? Locking and unlocking of knee joint. It was asked in 2023 and it will be again expected in 2026. Now, hip joint, frequently asked. There are so many questions which have been asked in the hip joint, the nerve supplying the hip joint, the range of movements at the hip joint, and as well we go down into the thigh. And FMG 2023, it was asked about sartorius, quadriceps femoris, and rectus femoris, the questions from the muscles of the front of the thigh. Now, in the gluteal region, it was asked about the functions of gluteus maximus and medius in FMG 2021 and FMG 2023 respectively. But that does not mean that we will miss other muscles. That is why I have put up in here additional muscles which may be asked ahead along with the nerve supply, along with the main functions. So if the tendency is to ask about the muscles, they have given two muscles in the past few years. So you expect new group of muscles which may be asked from you. So that's common sense. That's why I have worked upon these things so that what is in the examiner's mind and what can be the likely problem these people will be having and what you can expect ahead as well. Now, Trendelenburg's test, you cannot afford to miss this. See how many times it has been asked: 2021, 2022, 2022. Then the difference between direct and indirect inguinal hernia asked in FMG 2024. You have to remember this table. What is strangulated hernia, Hasselbeck's triangle, very, very important. And you have to know the boundaries of the Hasselbeck's triangle. In fact, I would just not stop here. I will also ask you to go through the auscultatory triangle, triangle of auscultation, the Lesser's triangle, the triangle of doom, and many other triangles which are there, which is in the my other books like Platinum. So over here, these are the very important things. So what are the muscles which cause at this level the medial rotation? And this has been asked. The three muscles were given: sartorius, semitendinous, and biceps femoris. So you can see. Then along with that, now coming to the lower down, we go in the esophagus and sites of anatomic constriction of the esophagus. That's a very, very important question asked in FMG 2025, asked in FMG 2024, and the arterial supply of the esophagus, that the left gastric artery is a branch of, and there's a branch of celiac trunk. It was asked in FMG 2024. The lymphatic drainage of stomach is important, and along as far as the spleen is concerned, so many things asked about the spleen, about the ligaments of the spleen. And I have put in the question which was asked over here. Then the male urethra, I have put in the main important questions which have been asked, which have been repeated. The male urethra, which is highly expected in FMG 2026 as well. Then psoas major as a muscle, the importance of the psoas major muscle has been asked in 2024. Then prostatic cancer, how the prostatic cancer spreads through the valvulus communication of the what we call as Batson's penis plexus. That has been asked in FMG 2025 recently, and you cannot afford to miss it. And again, the questions asked in FMG 2025 from an embryological perspective are the Meckel's diverticulum and intervertebral disc, which has from where does the intervertebral disc form, and it's a fate of the notochord, as you remember. Then pharyngeal arches, a very, very important questions which had been asked so many times. What develops from the first arch, what develops from the second arch, and I have put in some of the important things along from the derivatives of the second arch. The nerve supply of the tongue, which is the main nerve supply of the tongue, asked in FMG 2023, and other parts which might be asked, I have given over here. Then again, 2021, tongue is developed from what part, it has been asked in 2021. Now a very important question which was asked in 2023 from the ENT region is the Kiel's dehiscence, what it is, why it is, and I have given a description of that. So over here you can see so many things from the region of this pharynx and the larynx. Over here, the recurrent laryngeal nerve, the cricothyroid function, and the nerve supply to the vocal cords, that has been asked. The effects of the lesion of the recurrent laryngeal nerve, FMG 2022, and the muscles and their action, which is the abductor of vocal cord, which is the adductor of vocal cords, 2021, 2022. Then it was asked anencephaly. It was asked in FMG 2024, anterior neuropore, which fails to close, and what is the disability one can have. It is anencephaly. And as you can see, epidural hematoma has been asked in FMG 2022, lateral medullary syndrome or the Wallenberg syndrome. It has been asked in 2024, 2023. Then very important, the foramina of the skull, which are there, and what passes through what foramen, what passes through the internal acoustic matrix, what passes through superior orbital fissure, optic canal, inferior orbital fissure, say jugular foramen, say foramen magnum, say foramen ovale, foramen rotundum. As you can see, foramen ovale, as I was mentioning, FMG 2022. So you have to remember these things, what has been asked. And over here, the contents of the hypoglossal canal, as I mentioned you as well, and inferior orbital foramen, I mentioned you. Then the cranial nerves. Yes, some of the cranial nerves were asked, and hypoglossal nerve was asked in FMG 2024. Then as far as the histology is concerned, we get few questions from histology, but it was asked, what is the epithelium, the disposition of the epithelium, the germinal epithelium of ovary, what is it basically, and you know, simple cuboidal, simple columnar from the gallbladder, you know. So this is how I have tabulated other things which might be asked to you: ciliated columnar, pseudostratified columnar, stratified squamous epithelium, which are liable to be asked ahead. And then some questions were asked from the thymus, which is a repeated question, and Hassel's corpuscle, very important. You might be asked what these mean. Hassel corpuscle, where are the lobes and lobules present, where are the crypts present, tonsils, where are the corpora amelicia present, where are the corpora arenacia present, very, very important. From the embryological perspective, questions were asked from placenta, FMG 2022, implantation, the diaphragm, development of diaphragm, it has been asked along with diaphragmatic hernia, FMG 2024, 2024, 2024. So this is a roundup of the things which have been asked from anatomy. So this is how you will prepare, and this book, FMG Blitz, is one of the important books which covers all the 19 subjects, and I hope that you do well in all the subjects including anatomy. This is just a brief just about anatomy, how you have to prepare, what you have to prepare, and it is important. Thanks a lot.